Assalamu alaikum wa rahmatullahi wa barakatuh. Today will be our first session on the cold and flu season. This is done by the Health and Wellness Committee that is just recently launched during this subcommittee's term. Next slide, please. So the whole purpose of the Health and Wellness Subcommittee is really to enhance the overall health and well-being of our community at large. We see that this is a great need and a missing area in our community, and so we are here together as a huge team filled with doctors and professionals that are going to help create more programs, more seminars, more awareness on health and wellness, and how we can all become a lot more healthier and stronger as a community. We are looking for subject matter experts, so if you are someone who's already in this field and would love to assist during one of our programs, please do reach out to us by emailing us at health@orlandocenter.org. So today is our first talk. Our talk is going to be on Protect Your Health, and this is by Dr. Sepeedeh Kermalli. So before I give this to her, please give us a loud Dar es Salawat.
Assalamu alaikum, everyone. As Shaista said, I'm Sepeedeh. Nice to meet you all. Can you go to the next slide, please? So today we're going to be talking about the cold and flu season. We're going to do a pretty big overview and kind of cover a little bit of the topic. We're kind of already in cold and flu season, so we're a little bit late, but hopefully we'll get some good information in so that way you guys can be prepared going forward for the next couple of months. Next slide, please. So first and foremost, the disease and what symptoms to expect. Next slide. Okay, so what is a common cold? Think about your upper respiratory infection. It's basically a constellation of different symptoms that affect the upper respiratory tract. The upper respiratory tract is ears, nose, throat, your trachea, which is basically your windpipe, what you use to breathe with your lungs, right? And it's basically different types of symptoms that can affect all ages, especially pediatric patients, which is my specialty. Unfortunately, children under the age of 6 can actually have up to 8 colds per year. So that's a lot. And when you think about it, sometimes you'll see students and patients and kiddos who are suffering from illness for up to 2 weeks at a time. And right as they're getting better, they get hit with another illness and they get sick again. So sometimes it's really important to know what signs and symptoms to look for and what red flag symptoms will kind of push you to go to the ER, push you to go to your pediatrician, when you should talk to doctors and whatnot. Next slide. So what kind of symptoms can you look into? Okay, so typically you start having symptoms around 2 to 3 days after exposure. So if you come into contact with someone with COVID, with influenza, different types of viruses, usually day 2 and day 3 is when you start feeling ill. Typically fevers last about 3 days. Beyond the 3-day mark, if you're having fevers persistently, that is a red flag. Talk to your doctor. That's not normal, okay? Then you can also have symptoms like congestion. Congestion can be clear, it can be yellow, it can be green. I know that's kind of a misnomer. You think green bacteria, green sinusitis. That's not true. So back in the day, that was kind of the common belief. Nowadays, realistically speaking, you can kind of have it pretty much any color. Realistically speaking, the actual duration of your symptoms. So if you're having congestion, nasal congestion for over 10 days, that's when you start thinking, this probably is not a virus. Let me talk to my doctor. I might need some antibiotics for a sinusitis, okay? Other symptoms, sore throat, coughing, irritability, your belly's hurting, you don't really want to eat. Now think about this in terms of your pediatric patient population, right? So your kiddos are not going to be able to express necessarily that, hey, my throat hurts, right? So still think about that in terms of treatment management, and we'll talk a little bit more about what you can do for something like that. Lymphadenopathy is another one. That's basically the lymph nodes in your body getting swollen up. That's actually a good thing, right? That's your body's way of fighting off the infection. It might be a little bit scary feeling all these bumps across your neck on both sides, but actually that's your body's healthy way of fighting an infection. So that's actually a good thing. And again, not unusual for a child to develop a second cold as the symptoms of the first one improve. So always keep that in mind as well. Next slide. Okay, so the reason I think transmission and learning about transmission is important as a community is what we can do to avoid getting sick what we can do to avoid getting other people sick. So important to learn exactly what transmission and how it works. There's different ways you can get the virus, obviously direct contact. So if I cough in my hand, or if I sneeze and I don't cover my mouth, right, all those particles are in the air, and if someone passing by inhales, that's one way. So inhaling viral particles, very common. Particles on surfaces, that's another one. If you, for example, again, sneeze or cough in your hand, and then I go pick up a toy, throw it to the side, and a 9-month-old baby is just crawling by in the baby room and puts that toy in their mouth, all of a sudden you're thinking, hey, those viral particles that were on that toy are now in the baby's mouth. The viral particles can actually stay up to 2 hours on surfaces and on hands, okay? There's actually some viruses that have been shown to stay on surfaces for 24 hours, so be very cognizant and very smart in terms of what you're doing and educating our kids in terms of what we can do to get ahead of that. Next slide. Okay, so complications. So typically common cold, not really a big deal, but there are complications that it's important to be aware of, okay? So let's chat about that. Next slide, please. All right, so ear infection, super common. We see it a lot in pediatrics. If your kiddo is having fever beyond that 3-day mark, complaining of ear pain, there's pus coming out, those are signs. Talk to your doctor. They're probably gonna need some antibiotics, and that's completely normal and not uncommon. Sinusitis is another one. I know we talked about it a little bit, but if you're having severe nasal congestion, regardless of the color, beyond the 10-day mark, then we're thinking, hey, it's not a virus anymore, it's likely bacterial. Talk to your doctor and get on a course of antibiotics for that. Asthma. So asthma, we see it a lot in pediatrics. If you have underlying asthma as in childhood or in adults, there's going to be a trigger associated with the viral illness. If you catch a cold, you're probably going to have an asthma exacerbation. You're going to need steroids. You're going to need albuterol inhaler, right? Typically, that's a normal, type of event. However, there are patients who develop wheezing associated with viruses that don't even have asthma itself. It's just the virus triggering the wheezing, okay? So if you hear your kiddos develop any type of wheezing or any severe coughing spasms or like lots of coughing events once after the other, especially at night, talk to your doctor because they might be having wheezing associated with this specific virus, okay? Pneumonia is another one, obviously, especially in our pediatric patient and our elderly community. It's really, really prevalent, unfortunately, and it's very dangerous. So it's really important to think about fevers that are worsening beyond the 3-day mark, and then also having rapid breathing, coughing, and obviously high fever. So those are all things that you'll see. You're like having like a wet cough and you're really, really not feeling well. Those are signs to look for. The other thing, unfortunately, walking pneumonia is super relevant right now. We're seeing a huge outbreak all across Central Florida, unfortunately. So if you notice kids with persistent cough that's lasting about like 4 to 6 weeks and is still having high fevers, definitely talk to your doctor. It's caused by mycoplasma, and it's definitely something that we're seeing a lot more of. Unfortunately, there's not great tests for it, so it's going to be a little bit of a clinical diagnosis by your pediatrician. So talk to your pediatrician and see if there's any antibiotics warranted for something like that as well. Next slide. Prevention. So this is where we all come in as the community and as family members and as parents and caregivers, okay? So it's going to be super important for us to talk about this. Next slide. All right, so I can stand here and talk to you about vitamin C and about, zinc and elderberry, but realistically, the one basic thing that we really, really need to be working on is good hand washing. This includes teaching our kids how to have good hand washing skills, for us to have our hand sanitizer with us, taking those breaks, making sure we're washing our hands frequently throughout the programs, throughout different places that we're going, sporting events, whatnot. This is the main thing we can do as a community to make sure we're not spreading germs, right? Avoid touching our eyes, our mouth, our nose, because that's where the viruses are coming in from, right? So we have to be very careful in terms of what we're doing with our hand washing. Disinfectants, obviously decontaminating surfaces. We're thinking, right, if a virus is sitting on a surface for around 24 hours, we really need to be very good and cognizant about making sure we're decontaminating anything. Our teachers are doing that. Our healthcare workers are doing that. We should all be doing that as well. Simple things like we're praying namaz on those tables. Think about that. Think about your face going down on there. Just wipe it off. It's really easy, really fast, making sure we're sanitizing our toys, keeping our jamaat healthy and safe. Strengthening our immune system. Obviously, we want to set ourselves up for success. Sleeping right. I know that's hard to do. We were all very busy, but it's important to do that. Eating healthy, making good choices in terms of nutritional intake, exercise, getting your flu shot. Okay, next one, isolation. Okay, I know this is hard. We all have FOMO. We don't want to miss out on parties and mosque events and field trips with kiddos, but realistically speaking, you're most contagious within the first 2 to 4 days of illness. So if you're having fever, stay home. That's the best way to make sure we're protecting our community, protecting our families, okay? If you really, really need to go, wear a mask, be safe, protect yourself, protect others. The other one I wanted to touch on is babies, right? So I'm going to talk about RSV next. RSV season is here, and it's very, very, very important for us to make sure we're protecting our babies. Ages 0 to 6 months, they still haven't had the opportunity to develop their immune system yet. So right now, they're still getting acquainted with the world, and it's our responsibility to protect them. So make sure you're protecting our babies. No touching their face, no kissing their face. They really don't need it. Love them any other way you can, but just avoid kissing their faces because that's really dangerous for the baby. Yep, there we go, RSV. Okay, so as an ER doctor, as a hospitalist, I see a lot of RSV right now. It's heartbreaking and it's very dangerous. These kiddos end up in the hospital on very high respiratory support for days on end with IV fluids and hydration status that is really inadequate. And it's all because of a virus that if you and I got, it'd just be a common cold. You and I, we're gonna cough a little bit, we'll have a day of a fever and we're good to go. These babies, unfortunately, they really suffer with RSV. And unfortunately, we've had some really sad cases recently with RSV. So don't take it lightly. It's very important and we have to make sure we're staying away from our babies, making sure we're loving on them other ways without kissing them in their faces, okay? All right, next slide. All right, treatment is another one I wanted to touch on real quick. Why don't we go to the next slide, please? All right, so unfortunately, there's not really a cure for a cold, right? So antibiotics are used for bacterial infections. A cold is caused by a virus, right? So basics, antibiotics are not gonna work. You can go and talk to your doctor about it, but realistically, it's time and it's a lot of supportive care that's gonna get us through it. Over-the-counter medications, ibuprofen, Tylenol, decongestants, cough suppressants, those are things that we can use as adults. In the pediatric population for our kiddos, we want to avoid cough suppressants. So the AAP actually says no cough suppressants until 12 years old. And that's because think about all that gunk, all that congestion, all that mucus sitting up here. You want it to come out because if you give them a cough suppressant, it's going to sit right in their chest and it's going to become a nidus for infection. So we don't want that. We want it out. We want them to cough. Yes, they're gonna be miserable in the middle of the night. Yes, it's frustrating to see them suffer like that, but realistically speaking, it's actually better for them to get it out, okay? Humidified air, normal saline sprays, suction. There's lots of fancy suction nowadays that our parents didn't have that have like electric little things and you can put it in their nose. It's really great. There's a lot of resources. Make sure you're using them to support them through this illness. Again, antibiotics are not effective, and alhamdulillah, we've actually been blessed with a lot of herbal remedies as well, right? We know honey is a natural anti-inflammatory. Arman has this little elderberry immune tablet that he takes every single day with zinc and vitamin C in it. It's great. He loves honey. We do that all the time as well. Obviously, there's black seed oil. There's lots of different elderberry. There's a lot of different options. Definitely use it. It's a good immune response, immune boost, and it's really helpful, right? But realistically, going back to all of it, prevention is number one, and hand washing is number one. Okay. Next slide. All right, so I touched on this a little bit earlier, but when to seek help. This is like, okay, so I have my common cold, but now I'm having a little bit more than just the common cold, and I'm getting a little bit nervous. At what point do I go talk to my doctor again? When should I get reevaluated? Okay, next slide. All right, so if your child or yourself, obviously, refusing to drink anything for a prolonged period of time, then you're thinking, am I getting dehydrated? Is my child getting dehydrated, okay? A good way to assess if your baby's dehydrated is if they're having 4 or less wet diapers in a 24-hour period. Then you're like, this is not good. This is a red flag. Let's go to the hospital. Let's go to my doctor. Let's see if they need IV fluids, if there's something else that I can be doing to help my child. Behavior changes, specifically being lethargic, right? The word lethargic is a huge red flag in my book. When a parent comes and tells me, my child's lethargic, already my brain is going, right? Because you're thinking there's something seriously wrong, and a common cold, doesn't necessarily do that. Flu does, I will say, influenza definitely does, especially in the adolescent population, but beyond that, I'm thinking maybe there's something bacterial going on, okay? Difficulty breathing, working hard to breathe, wheezing, rapid breathing. Okay, this one, you can tell if your baby is not doing well by literally just lifting up their shirt and watching them breathe. Literally, hold up their shirt, watch them breathe. That's what I do the first thing when I go see a patient. Record it, send it to me, send it to your pediatrician. Think about how they're breathing. If they're using their belly, they're pushing out their belly every single time. You see their diaphragm. You see the outline of their ribs getting sucked in every single time. Those are all red flags, not good. That means their oxygenation might be low. That means they're having a difficult time breathing and they might need help. Means you need to go to the emergency department. A lot of times we see that with RSV specifically, but you can see that with other viruses too. So it's super important to make sure you take a look at that. All right, I already talked about fever lasting for more than 3 days, because then you're thinking, is it bacterial? Is there something else going on? If your eyes become red, you think about conjunctivitis, definitely need antibiotics for that. And then anytime a baby under the age of 2 months old has a fever, that is by definition a medical emergency and will require attention from a pediatrician at once, okay? Because then you're thinking their immune response is not fully developed, but also their blood-brain barrier is also not developed yet. So anything that's infecting the body can also be affecting their brain, and it's dangerous. Okay? Next slide. Okay, I'm almost done. Sorry, guys. Okay, next slide. Okay, so super, super basic. The common cold, mild typically, self-limiting, which means I could do actually absolutely nothing, but you guys will get better with a cold, okay? And that's caused by a virus and can cause a bunch of different variable degrees of symptoms, okay? Including malaise, including headache, sore throat. Realistically speaking, the way that we really approach this, like our mainstay of management, is patient education and parent education. So you can understand what to expect during the course of the illness, indicate when you can be reevaluated, and tips obviously with supportive intervention. Again, caused by viruses, diagnosis is really clinical. I don't need a swab to tell me you're not feeling well, right? Like, I know you have a virus, you'll get through it, right? But majority of the time, supportive care is indicated, and again, prevention is good hand washing. All right, thank you guys so much. I hope you guys learned a little bit. I'm here all the time. If you need anything, call me, text me. I'm always available. And inshallah, stay safe, stay healthy, and stay warm. Thank you.